1199 SEIU members have the most comprehensive package of benefits in the country because we believe our healthcare workers deserve the best. Our unique benefit package enables you to enjoy comprehensive health insurance with zero out-of-pocket expenses, no deductibles, no premiums, and no co-pays. We believe it's coverage unlike anything you've ever seen.
There was a time when healthcare workers, they didn't have benefits. They would take care of patients that were in beds, they would make up the beds, but if they got sick, they could not afford themselves to get into the bed. And it was only when we began to organize healthcare workers that the whole idea of healthcare workers deserving to have a decent wage and healthcare benefits, that it became something that workers were willing to fight for. And believe me, it was incredible fights that it took to get these benefits for the workers.
We have one of the greatest packages in the world for any membership in America.
When I go to a physician, I don't have to have money in my pocket. I can just carry my card and I'm covered.
I have the best doctors in Staten Island and over here in Manhattan.
It is unusual to be able to have family covered without co-pays and without a huge amount taken out every month from the paycheck.
But whenever I see a co-pay zero, I feel so excited. Yes!
1199 SEIU offers the same excellent member benefits not only for you, but for your spouses, partners, and family as well.
I raised my kids through the 1199. They pay for all the benefits until they were 23 years old.
My daughter lives in North Carolina, and even as far away as we are still from New York City, she can still enjoy the benefits of 1199.
Most Americans who have health insurance pay at least part of their premiums and have hundreds of dollars of deductibles and co-payments for every doctor's visit and prescription. But with 1199 SEIU, you pay nothing. No paying for prescriptions, ER, or doctor's visits, and still get tremendous choice.
The benefit fund is different than a commercial insurer because we exist solely for the purpose of providing health benefits to our members. We hold the members' money in trust, and we don't take any profits, and we administer the fund as efficiently as possible so that the maximum dollar goes to the provision of health benefits for our members.
The way the industry is changing right now, as I speak to many of my friends, they're telling me what they have as deductible, copay, and in these past 19 years, $11.99. You know, when I've gone to the dentist, it's been free. When I needed medication, it's been free. When I had my x-ray done, it's been free and no out-of-pocket costs, and it's been a real blessing.
The average that a worker has to pay in order to access a family coverage plan is about $3,000 per year. Our members pay nothing, and that's because we want to make sure that cost is never a factor for our members when it comes time to access health care. We want to make sure that our members have the access that they need, whether it's to preventive care, whether it's to acute care. We want to make sure that cost is never a factor when they make a decision about prescription medication, physician services, dental services, and that's the philosophy that underlies our fund.
Yo tuve muchos beneficios buenos porque a mí me dio cáncer y la unión yo tuve todo, fue muy bueno.
I'm diabetic and all my diabetic prescription is covered, full covered through the 1199.
We are providing health care for those who provide health care. We care for the caregivers, so we do our best to make ourselves as accessible as possible to our members, whether at their workplaces, in their neighborhoods, or right here at our headquarters. We have people staffing the phones, we have outreach workers out in the shops. We want to make sure that our members take every advantage of the benefits that they've worked so hard for.
The people themselves who work in the benefit fund go that extra mile with you. Whenever you call them and ask a question, they're always ready to serve you. You might have the care, but the people helping you with the care.
The outreach program is wonderful because it's doing exactly what it says it's doing. It's outreaching.
Every single month they provide someone from the benefit fund to tell them how good the benefit is.
Members are informed in advance, weeks in advance. Flyers are distributed telling you where they're going to be located.
We give literatures explaining the benefits in detail, all aspects of 1199 benefits.
Para mí el servicio de la Unión es muy bueno.
They have a variety of doctors to choose from, and they're good physicians, and you can choose a doctor that you feel is meeting your needs for you and your family. You have physicians that are specialists in all areas of healthcare.
I live in Connecticut, so I'm able to go to doctors and hospitals in Connecticut, and I haven't had any problems with the bills.
I could see doctors without referrals, the way it's set up for me, and I don't have to have any copay to get to doctors, so it's all covered as long as they're part of the Member Choice Providership Program.
It's a good plan. I'm very happy with it.
Here are some of the highlights of your new plan. Be sure to check your Member Services Handbook for the full range of member benefits.
It's a good feeling to know that, that you work for a place, that you have a union that has your back.
Is that a lot of the membership don't realize and don't recognize the quality of care that we have with this 1199.
The benefit fund is one of the best that I've ever been in.
I don't have to pay anything. I feel so, I'm so happy for that.
Growing old will be wonderful, and I won't have to worry about being taken care of. I don't think anyone could say anything better than that.